Good afternoon, everybody. We are here today to talk to you about renal tubular acidosis. This presentation is by myself, Shelby Swain, and my two partners, Savannah Bjarnason and Sienna Erickson. So, to start out, what is renal tubular acidosis? So, renal tubular acidosis, also known as RTA, is a disease that occurs when the kidneys fail to excrete acids into the urine, which causes a person's blood to remain too acidic. This is called acidosis. This is what happens when the pH of your blood is very, very low and it gets to dangerous levels. So, without proper treatment, chronic acidity of the blood leads to slower development, kidney stones, bone disease, chronic kidney disease, and possibly total kidney failure. There are a couple of things that cause RTA. The first one being when the body performs its normal function, it produces acid. If this acid is not removed or neutralized, the blood becomes too acidic. This can lead to electrolyte imbalances in the blood, and it can also cause problems with the normal function of some cells. The second cause is the kidneys help control the body's acid level by removing acid from the blood and excreting it into the urine. So when the kidneys aren't performing this, our blood gets too acidic. The last one being distal renal tubular acidosis, also known as type 1 RTA, which is caused by a defect in the kidney tubes that cause acid to build up in the blood. Who can be affected? So, renal tubular acidosis may be a permanent inherited disorder in children. However, it may be an intermittent problem in people who have other disorders such as diabetes mellitus, sickle cell disease, or an autoimmune disorder such as systemic lupus erythematosus.
My name is Sienna, and I will be talking about the signs and symptoms and the normal physiology of renal tubular acidosis. So the signs and symptoms include confusion or decreased alertness, fatigue, impaired growth in children, increased breathing rate, kidney stones, nephrocalcinosis, which means too much calcium is deposited in the kidneys, osteomalacia, which is softening of the bones, and muscle weakness. And here we have an image of the signs and symptoms that are included. So now I will be talking about the normal physiology. In the normal physiology, each of your kidneys is made up about 1 million filtering units called nephrons. Each nephron includes a filter, called the glomerulus, and a tubule. The nephrons work through a two-step process. The glomerulus filters your blood, and the tubule returns needed substances to your blood and removes the waste. As blood flows into each nephron, it enters a cluster of tiny blood vessels in the glomerulus, and then the thin walls of the glomerulus allow smaller molecules, waste, and fluid, mostly water, to pass into the tubule. Larger molecules such as proteins and blood cells stay in the blood vessel. A blood vessel runs alongside the tubule as the filtered fluid moves along the tubule. The blood vessel absorbs almost all of the water, along with the minerals and nutrients your body needs. The tubule then helps remove excess acid from the blood, and then the remaining fluid and waste in the tubule become urine. So here's an image that shows the normal physiology of the kidneys and the process that has to get the urine out of the ureters. So here in the purple is the proximal tubule, which in areas is affected, and then the distal tubule in blue is also affected depending on the different type of renal tubular acidosis that you have. So next, I'll be talking about the different types of renal tubular acidosis. There are three main types, the first one being proximal renal tubular acidosis, the second one being distal renal tubular acidosis, and the third one involves a deficiency or resistance to its action that leads to impaired reabsorption of sodium ions with decreased elimination of hydrogen ions and potassium ions, which is less common. So first we're going to talk about type 1, which is proximal renal tubular acidosis. This is where it affects HCO3 reabsorption due to a defect in proximal tubular reabsorption. HCO3 is lost in the urine, which reduces these levels in the plasma. With the loss of sodium ions in the urine, there is an increase of extracellular fluid that follows that then increases aldosterone secretion, and a decrease in serum potassium ion levels, leading to HCO3 being lost in the urine. Usually the plasma levels of HCO3 are greater than 15 millimoles per liter, and rarely lead to severe acidosis. Type 1 can be hereditary or an acquired disorder, and it may just be an isolated defect in HCO3 reabsorption, which is really rare, or it can be linked with other defects like Fanconi syndrome. And treatments include children with proximal RTA require alkali therapy because of high risk factors, and it is usually combined with potassium supplements. Adults may require alkali therapy. Type 2, distal renal tubular acidosis, affects the secretion of fixed metabolic acids, and it affects the distal convoluted tubule and the collecting duct. This is where 15% of bicarbonate is absorbed, which causes the hydrogen ion secretion to decrease, and this results in the contraction of fluids, which then increases aldosterone production and developing hypokalemia. Long-term acidosis requires skeletal system involvement, where there's more secretion of calcium from the bones. This then increases calcium output in the urine, leading to increased parathyroid hormone, osteomalacia, bone pain, and impaired growth in children, as well as kidney stones and nephrocalcinosis. So some complications can arise like hypokalemia, hypercholemic metabolic acidosis, inability to acidify the urine, nephrocalcinosis, nephrolithiasis, and it can also include osteomalacia and rickets.
Hi, my name is Savannah, and I'm going to be talking about the complications and treatment options associated with renal tubular acidosis. So to start off, the overall complications of renal tubular acidosis are metabolic bone disease, kidney stones, as well as growth failure in children. For the overall treatment, to treat the effects of RTA, it is necessary to restore the normal acid level to the blood. To do this, doctors prescribe alkali medicines such as sodium bicarbonate that help lower the blood's concentration of acid. Most of the time, the treatment for RTA is effective. For treatment of proximal renal tubular acidosis in children, they require alkali therapy because of high risk factors, and it's usually combined with potassium supplements. Also, adults may require alkali therapy. For distal renal tubular acidosis, they prescribe alkali supplements that are usually used as long-term treatment options, which then allow for the correction of potassium waste. This also decreases the calcium in the urine. This is prescribed at a higher amount in children because of the need for it in their growth, and they also produce more bicarbonate waste. How can you reverse the effects of renal tubular acidosis? You can do this by staying hydrated, drinking plenty of water as well as other fluids. You can keep control of your diabetes. If you manage your blood sugar levels well, you can avoid ketoacidosis. Also, stop drinking alcohol. So chronic drinking can also increase the buildup of lactic acid. For new treatment, since the current treatment of renal tubular acidosis is effective, there isn't really new treatment options that cure the disease. Instead, they mainly focus on symptom control as well as the control of complications that come with renal tubular acidosis. For treatment, they use alkali in the form of sodium and or potassium bicarbonate or citrus salts that should be administered to maintain normal serum bicarbonate concentration. But this also increases the fluid output, which then in return increases the need for medication. This then leaves room for improvement when it comes to treatments. And then finally to our questions. So question 1. In renal tubular acidosis, it is a condition that occurs when the kidneys aren't filtering properly and the blood is too blank. Question 2. The cessation of alcohol can reverse acidosis. True or false? Question 3. The function of the renal tubules is to return the substances your body needs to the blood. True or false? Question 4. The proximal tubule disorders affects the reabsorption of blank. And question 5. Alkali supplements are used to treat blank tubular disorders. And then these are our answers. So for question 1, a condition that occurs when the kidneys aren't filtering properly and the blood is too acidic. Question 2, the cessation of alcohol can reverse acidosis. This is also true. Question 3, the function of the renal tubules is to return the substances your body needs to the blood. This is true. Question 4, proximal tubule disorders affects the reabsorption of HCO3. This is also known as bicarbonate. And question 5, alkali supplements are used to treat distal tubular disorders. And then finally, these are our references, and we hope that you enjoyed our presentation.